I want to talk about one of the latest technologies. Very popular. We were talking about it before we started this interview. Balloon sinuplasty.
Yes.
Sounds like a pretty complicated thing, but what actually is it and what is the purpose of it?
This is really one of the best innovations I've seen since I've been practicing. And what we do with the balloon sinuplasty is we open up the natural opening in a more natural way. In the past, when you would come in, let me go back and kind of give you a history. We'll go back about 35 years ago.
Sure, please do.
35 years ago, the methods of surgery that we did on the sinuses were somewhat barbaric. And we would go in, we would make holes under the cheeks and make holes into the sinuses and make incisions along the side of the nose, and we would open these things up and try to get in to clean the sinuses out. When we made a hole in the nose that went into the sinus behind the cheek, we tried to put that hole as low down as possible so that gravity would pull it out. What we didn't know is the sinuses have little brooms in them that we call cilia. Right. And those brooms swept everything out to the natural opening. So we could have a huge window in the sinus, but if it wasn't at the natural opening, it didn't matter. It wouldn't drain because the brooms are trying to sweep out the natural opening. You can have a hole in the wall, but if the woman of the house is wanting to take and sweep everything out through the door, it's not going to go through the hole. Right. So, you know, my wife is real meticulous. We actually have a vacuum cleaner at Central, but if that's what you're going to do, it's not going to work that way.
Right.
What this did is this basically, about 25 years ago, 30 years ago now, a method was brought to this country from Ireland. A fellow by the name of Kennedy, and Dr. Kennedy brought a method where you could go in endoscopically and open up the natural openings. And he is the father of endoscopic sinus surgery in this country. About 7 years ago, Dr. Kennedy and I were sitting across from each other at our board of directors for our national organization, and people were presenting to us the idea of the balloon sinuplasty. And Dr. Kennedy and I looked at each other because we were friends, and I'd done a lot of sinus surgery, and we were both sitting on the board of directors of the academy, and we were really looking, thinking, I am not sure this is going to work. I mean, we had a very, very skeptical eye. To make a very long story short, I began to do these about 6 years ago here in Knoxville, and our group was the first group to do it here. At the time we started to do it, we were confining it pretty much to the frontal sinuses, which are the sinuses behind the forehead. We would go in with a wire guide, pass that wire into the sinus, follow it with a balloon into the sinus. We dilated the balloon at the level of the natural opening. By doing that, it would crush the bone, but not destroy the lining. In the old days, even with the endoscopes that Dr. Kennedy brought to this country, if you went in, we used instruments that would destroy the lining. So if I created a large hole, but the lining had been destroyed, what would occur is as it scarred down, it would close again. And that was a recurrence of the problem. The lining is made of mucosa, which is very elastic. It's very stretchy. So the balloon allows me to open up the bone, but not cause the scarring as much. And this is just a phenomenal technology. The other benefit to it is it forces me to be a better surgeon. Because in the past, even with the endoscopic procedures, you could go in and poke the hole in and still not be at the right location.
Right.
And the brooms that are in the sinuses are still wanting to sweep it out the natural opening. So
this has been compared in many ways to the balloon for angioplasty.
Absolutely.
Is that a good comparison?
It's not only a good comparison, as I understand it from the people that developed this technology, that is where they got their idea, was actually from the angioplasty.
Is this regarded as safe? I mean, is it effective and safe?
It is effective, and it is so much safer even than what we've done and what we do in our traditional surgeries. And we still do traditional sinus surgery. But when you do traditional sinus surgery or even the balloon, you're right next to the eyes, you're right next to the brain, and neither of those structures can be injured. With the introduction of the balloon, it has enabled us to be able to dilate these structures, to go in and open them up with just no real risks to the brain, no real risks to the eye. A surgeon that's used to being there should be able to do this procedure pretty confidently without any injuries at all.
How long does the surgery take?
Oh, it varies. In In the hospital, of course, we're putting you asleep. We have the prep time for that, and you're probably looking at 20 to 45 minutes. In the office setting, the prep time is about 45 minutes of prep time while we're getting your nose to where you don't feel things, and the procedure itself usually runs about 10 to 20 minutes.
How do you determine if it's best for the patient to go into the hospital to have it done, or if it's going to be okay to do in your practice, in your office?
Right. That's an excellent question. And it does vary. I would say that in my own practice, I use about 3 different criteria. Number one is sometimes the insurance won't allow you to do it in the office. So if they don't allow you to do it in the office, you have to do it in the operating room.
Interesting.
Number two, however, is you have some patients that are just too high risk to put to sleep, either because of their heart disease or their lung disease. You just really want to try and avoid putting them to sleep. On the other hand, if you're doing something that's really no more invasive in many ways than a bad day at the dentist, you can do this in the office, and it's safer for them than it is putting them to sleep. And then the third thing that you have to look at really is, can the patient tolerate this in the office? Is the patient of a personality type that they are okay with doing it? And it's interesting because when you begin to do this on some patients, you will see that some patients really aren't enjoying the procedure, and other patients act as though nothing has happened at all.
So what is the success rate of balloon sinuplasty?
That's a good question. I will give you my own personal experience.
Okay.
In my own personal experience, to tell you how well this works, we have had patients that in the office, when I've done the balloon, of course they're awake in the office, that's the reason I am using this as an example. I have actually gone in, dilated the balloon up, and as soon as it's been done, the patient goes, wow, it's open. One patient had had 3 previous surgeries by other physicians, and we dilated it up, and as soon as I inflated the balloon and deflated it back, he looked at me and said, "That's it." He said, "It's gone. It's gone."